This is Chapter 1 of Conquering Scoliosis Pain by Dr. Clayton J. Stitzel. Scoliosis is a complex spinal condition that affects millions of people worldwide, causing the spine to curve sideways in a characteristic S or C shape. While it is most commonly diagnosed during adolescence, many individuals continue to live with scoliosis well into adulthood, and for some, the condition may not even be diagnosed until later in life. Scoliosis can range from mild to severe, and while some individuals experience little or no physical discomfort, others struggle daily with chronic pain, stiffness, fatigue, and physical limitations. For adult patients, scoliosis-related pain often becomes a constant companion, not just an occasional inconvenience. Over time, the uneven pressures placed on muscles, joints, discs, and nerves can lead to persistent discomfort, reduced mobility, and diminished quality of life. What makes scoliosis-related pain particularly challenging is that it is often multifactorial, resulting from a combination of spinal misalignment, muscle imbalances, inflammation, nerve irritation, and even psychological stress. For adults living with scoliosis, this ongoing pain can take a heavy toll, not just physically, but emotionally and mentally as well. Many suffer in silence, feeling misunderstood or overlooked by a healthcare system that too often focuses solely on the degree of spinal curvature rather than the day-to-day experience of the person living with it. You may feel like you've tried everything, from physical therapy and massage to medications and injections, only to find that the pain always returns. It's frustrating, exhausting, and discouraging. You might wonder if anyone truly understands what it's like to wake up every morning already in pain, to avoid certain activities because of fear of flare-ups, or to feel your condition gradually limiting your ability to enjoy life. If this sounds familiar, please know that you are not alone, and your pain is valid. This book was written with you in mind. Whether your scoliosis was diagnosed decades ago or only recently discovered, whether you experience occasional discomfort or constant pain, the goal of this book is to provide more than just information. It is here to provide hope. Within these pages, we will explore the root causes of scoliosis-related pain, how it differs from other types of back pain, and how factors like inflammation, posture, and aging contribute to your discomfort. But most importantly, we will discuss real, practical, and evidence-informed treatment options that go beyond temporary fixes. These include non-surgical therapies like the ScoliSmart Activity Suit, targeted exercises such as Pilates and yoga, massage therapy, nutritional support, anti-inflammatory strategies, and even advanced medical interventions for those in severe pain. You deserve answers. You deserve support. And you deserve options. This book aims to encourage you by shedding light on what's happening inside your body, inspire you with stories of others who have found relief, and empower you with tools and knowledge that can help you take back control of your health and your life. Chronic scoliosis pain doesn't have to be your final story. This is just the beginning of a new chapter. What is chronic scoliosis pain? Chronic scoliosis pain is a long-term, often debilitating form of discomfort experienced by individuals with spinal curvature. Unlike the short-term aches and muscle soreness many people occasionally feel, chronic pain persists for months, or even years, and can interfere significantly with daily functioning. In adults with scoliosis, this pain is not just about the spine curving. It's about how the curve disrupts the normal biomechanics of the entire musculoskeletal system. This disruption can strain muscles, pinch nerves, wear down joints unevenly, and lead to chronic inflammation. Pain can present in many forms: a dull ache in the lower back, stabbing sensations near the shoulder blade, radiating nerve pain down the legs or arms, or a constant sense of tightness and fatigue. For many scoliosis patients, the pain may fluctuate throughout the day, becoming worse after long periods of sitting, standing, or physical activity. What makes chronic scoliosis pain unique is its persistence and complexity. It is rarely caused by a single factor, and often requires a multidimensional approach to understand and treat effectively. How can you differentiate between scoliosis pain and other forms of pain? Differentiating scoliosis-related pain from other types of pain can be challenging, particularly because symptoms may overlap with more common conditions like degenerative disc disease, arthritis, or fibromyalgia. However, there are a few key features that help distinguish scoliosis-related pain. Asymmetry. Scoliosis often creates uneven muscle tension and load distribution. One side of the back may be overworked and sore, while the other side may feel weaker or more fatigued. This imbalance is a signature sign of scoliosis-related discomfort. Postural triggers. Pain that intensifies after sitting or standing for extended periods, particularly if the posture is not well supported, often suggests a spinal alignment issue. Many scoliosis patients report relief after stretching or lying down, which helps decompress the spine. Localized discomfort. Unlike systemic pain conditions that affect multiple areas of the body equally, scoliosis pain tends to be localized along the curve of the spine, near the ribs, hips, neck, or shoulders, depending on curve location. Progressive nature. Pain that slowly worsens over time, particularly in conjunction with spinal degeneration or increasing curvature, may point to scoliosis as the root cause. Failure to respond to general treatments. Many scoliosis sufferers report that general back pain remedies, such as traditional chiropractic adjustments, painkillers, or standard physical therapy, offer only temporary or minimal relief. This is often because these treatments don't address the underlying structural imbalance caused by scoliosis. If you're experiencing persistent back or neck pain and have a history of scoliosis, or suspect you might have it, it's important to consult with a scoliosis-informed healthcare provider who can perform a physical exam, postural analysis, and appropriate imaging to determine the source of your discomfort. How acute pain becomes chronic pain. Understanding the transition from acute to chronic pain is essential in managing scoliosis-related discomfort. Acute pain is a normal physiological response to injury, inflammation, or stress. It serves a protective role, alerting the body to a problem that needs to be addressed. In the case of scoliosis, acute pain might result from sudden strain on a muscle, overexertion, or irritation of a spinal nerve. In a healthy system, acute pain resolves as the body heals. However, in scoliosis patients, healing is often disrupted by the ongoing biomechanical stress imposed by the curved spine. The spinal misalignment may continuously irritate nerves or overload muscles, preventing complete recovery. Over time, the nervous system itself becomes overly sensitive, a process known as central sensitization. In this state, pain signals are amplified, and the threshold for pain is lowered. What once caused minor discomfort may now result in significant suffering. In addition to nervous system changes, psychological factors like stress, anxiety, and depression can exacerbate the transition to chronic pain. These emotional responses, often heightened in those who live with daily physical limitations, can increase muscle tension, disrupt sleep, and lower pain tolerance. This complex interaction of physical and emotional stressors creates a feedback loop that reinforces chronic pain patterns. Recognizing this shift from acute to chronic pain is key. If pain persists beyond the normal healing time frame, typically 8 to 12 weeks, it should be considered chronic and addressed using a more comprehensive, long-term strategy. The role of age, gender, spinal curvature severity, and curve location in scoliosis-related pain. Several personal and structural factors contribute to the experience and intensity of scoliosis-related pain. Understanding how these variables interact can help guide more personalized and effective treatment plans. Age. Age is one of the most significant predictors of scoliosis-related pain. In adolescence, scoliosis typically does not cause pain unless the curve is severe. However, as individuals age, the cumulative effects of abnormal spinal mechanics take their toll. In adults over 40, Scoliosis-related pain often increases due to disc degeneration, joint arthritis, and loss of muscle tone. Additionally, older adults may experience adult degenerative scoliosis, a condition where the spine begins to curve due to disc collapse and facet joint arthritis, even if they did not have scoliosis in youth. Gender. Scoliosis is more prevalent in females, particularly in more severe and progressive forms. Hormonal influences, muscle mass differences, and connective tissue elasticity may all contribute to this gender disparity. Additionally, female scoliosis patients often experience worsening symptoms during hormonal transitions such as puberty, pregnancy, and perimenopause, when joint laxity and inflammation may increase. These hormonal fluctuations can amplify pain levels and curve progression, especially if not proactively managed. Spinal curvature severity. Not surprisingly, the severity of the spinal curve, measured in degrees using the Cobb angle, plays a critical role in pain development. Mild curves under 20 degrees may cause little to no discomfort, while moderate to severe curves, above 40 to 50 degrees, are more likely to produce structural imbalance, muscle strain, and nerve compression. However, it's important to note that pain severity doesn't always correlate perfectly with curve size. Some individuals with minor curves experience significant pain due to nerve involvement or muscle compensation, while others with large curves may remain relatively pain-free for years. Curve location. Where the curve is located on the spine also influences the type and severity of pain. Thoracic curves, upper mid-back, can affect rib cage symmetry, causing discomfort during breathing, arm movement, or rotation. Lumbar curves, lower back, are more likely to impact weight-bearing structures and contribute to hip and leg pain, including sciatic-like symptoms. Thoracolumbar curves, mid-lower back, often produce a combination of both thoracic and lumbar symptoms, making them particularly complex to treat. Curve direction, right or left, and the presence of double major curves can further complicate the clinical picture and require a more specialized management approach. This is Chapter 1 of Conquering Scoliosis Pain by Dr. Clayton J. Stitzel.